everybody, Dr. Jody Kinney. Today I'm going to continue my series on adjusting babies and children. This is my patient, baby James. He started getting adjusted because he had torticollis, which is a condition where babies sometimes when they're born have a hyper-contracted muscle in their neck and it doesn't allow them to have full neck range of motion. For James's situation, his was worse on the left side and he could only really look to the right. So we worked and worked and worked to reestablish healthy range of motion in his neck. And now he's doing real good. But I'm gonna show you what we do to adjust the baby. All done, good job. That's James's sister. Okay, so we're gonna just start at the bottom. We wanna make sure the entire spine and pelvis is cleared out of any misalignments or subluxations because a healthy spine starts at the top and goes all the way down. So as we're working, I use my little handheld adjusting tool called an activator, and we clear out all the misalignments and little imbalances in his spine. As you can see, his neck strength has gotten so much better, right, Mom? How much better? Yeah. So he's really turning right and left pretty good now. Can you turn this way? Okay, he's looking at his sister. All right, so I'm gonna have him turn over on his back so we can see how well his motion is. So this is his left motion, which we really had a hard time doing when we started, and his right motion is so perfect. Again, little finger pressure is all you need to adjust babies, and a little bit of motion one way and the other, just to make sure that every spinal joint is moving perfectly. And then for James, what we really needed to do, because he would only turn to the right, is we were stretching him to the left. He doesn't love this part, and that's understandable. I don't love to stretch myself, but as we are doing that over time, several adjustments, weeks of adjustments, right? We were able to establish that healthy nerve supply and motion in his spine. Look how good he's turning to the right and the left now, right? So that's how we adjust babies with torticollis. If your child struggles with torticollis or any kind of imbalances in their cervical spine, have them checked by a chiropractor, bring them in. It's a healthy, safe way for your baby to establish healthy motion. All right, thanks so much for tuning in. We'll see you again.